And so we already cleaned the skin or for whole skin. Okay. So that I mentioned earlier, she underwent 2 cryolipolysis. Let's examine her overall face. Before treating the lower face, it is essential to assess the mid-face because problems in the mid-face often contribute to sagging in the lower face. In this case, there is no significant aging sign on her mid-face because she is young. However, you can see a slight hollowing subzygoma here. So, I'd like to inject here. Asian patients tend to prefer soft, rounded contours. Next, let's examine the chin area. From the frontal view, the chin length adequate. But chin apex appears slightly flat, so she needs pointed chin. Okay, turn to the left. From profile view, her chin lacks slightly forward projection. The idea of Asian aesthetics line is nose, lips, and chin aligned in a straight line like this. So she needs forward projection and pointed chin. Face forward. Next, decide the injection point of chin apex. When we are choosing the injection point of chin apex area, we should recognize 2 landmarks. One is the pavilion, which is the most anterior point of the chin. Another one is the mandible, which is the lowest point of the chin. I will inject between these 2 points here. Okay. Next, let's assess from a profile view. Okay. You can see her mandible angle is a bit obscure, and her jawline is slightly unclear. So I'll inject here because this point helps to define the mandible angle and to support stretching the around jaw fat. And to enhance it further, I'm injecting along the mandible line to create smooth and defined line connecting to the chin apex. Okay. Next, when she curls her mouth, you can see contraction of the mentalis muscle along with slight hardness here. Therefore, I will inject into this area to reduce the mental crease. Okay, that's all for assessment and marking. Okay. Let's move on to the injection. Can I go on, Stephen?
Yes, go ahead.
Okay. There. Okay. I'll begin with subzygoma. This is entry point. Clean the skin. Pinch. And clean again. Needle in. Can you see?
Yes, we can see.
Okay. Caliber in. In Asian patients, there is often some resistance here. Okay. So I proceed gently with the cannulas.
What product are you using, Kumiko?
So I use volume now. So funding technique and subcutaneous layer. Now gently proceed. Slow injection. Okay, 大丈夫ですか? Can you see Dr. Steven?
We can see it clearly, and you are in the subcutaneous plane.
Yes,
Believe
now
it.
subcutaneous brain. So, okay. Okay. I use volume with cannula subcutaneous layer 0.5 milliliter. The goal is contour soft, gentle curve in the lateral midface. Okay. Next, we're gonna move on to the mandible angle. Sorry. When we inject here, the patient needs face up and turn into the side in order to detect the mandible angle and to inject easier. And to avoid widening the face, I inject from behind the mandible angle, not from the side. Okay, clean the skin. I use needle.
Do you think you can move the model slightly to the left so we can see better? If it is possible. Yes, much better.
Yes?
Perfect.
Okay, thank you. Okay. I need to use needle. Needle in, that's the bone, and slow injection. Yes. I use borax technique. Slow and slow.
So you come from the back because you don't want to widen the width
Yes.
of the lower
Yes.
face.
Yes. This injection helps define the mandible angle and contribute to straightening jaw front. Here, so we create posterior back. Okay, next. We're gonna move on to the chin apex area. For this area, I prefer to use needle because anterior approach allows more precise control over the design. And when I inject here, I always image like making filler. Yeah, I will show you this technique demonstrating. Clean the skin.
Perhaps you can move the patient towards you a little bit so we can see your point of entry.
Mm-hmm. Okay. Can you see?
If you, yeah, much better. Perfect. Now we can see clearly.
Okay, right. So I use needle, needle in, touch the bone, and small injection, and withdrawing, slowly withdrawing, and up to the deeply subcutaneous layer. I made one pillar. The other side, touch the bone, the small injection, and slowly and withdrawing up to the deeply subcutaneous layer. I made two pillars. The other side, touch the bone, the same technique. When injecting here, pinch the area firmly to prevent the product from spreading vertically, and always tactile awareness of the product, my fingers. Sorry, cannot get.
So Kumiko, explain to us why you inject that point.
Mm-hmm. So because I want to create more precise control over the design, I use needle, so the minimum amount of volume we can create.
Okay.
I use needle, the point G. Okay. So next, we're gonna move on to the mandible border. At this point, we've already sharpened the jawline because we create post anterior inferior and posterior vectors. Can you see? Yes. But I'd like to enhance it further. I'll inject along mandible line. Okay. This is entry point. Clean the skin and pinch. Clean again. And needle in. Okay. Open the mask. This is uncomfortable area for the patient. Always be open the mouth and be relaxed. Advance the cannula towards the area below the chin apex and throw injection.
So where are you now?
Subcutaneous rear.
Okay.
I'm in subcutaneous rear. During injection, I pinch the area by 2 fingers like this in order to control the product distribution. Make sure that the filler remains between my 2 fingers like this. I want to create a straight pipeline, and I always maintain the filling of the product between my 2 fingers. Okay. Throw injection, and we can create pipeline. Okay. Mute. Please observe my left hand. I'm continuously molding the rear while injecting. Okay. Okay. Good. Okay. 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 Next, and finally, I will inject harness around the mentalis muscle. This is some uncomfortable area for the patient, so open the mouth. So they ask to open their mouth during the injection, which helps reduce discomfort. This is entry point, clean the skin, and clean again. Needle in. Okay. Open the mouth, yes. I use volume to subturn into the subcutaneous layer. So funny technique. Yeah. So be careful not to overfill the central heart in labial fold, because the idea of the chin profile view has a slight dip with projection in the labial fold. Yes, throw injection, gently, and through injection.
So this is voluma in subcutaneous,
yes,
the labiomental region.
Yes. Okay. Okay, Dr. Steven. That's all for my injection of half side.
Okay.
I'll continue to inject outside and then show you the result later.
You have plenty of time, Kumiko. Why don't you just sit the patient up and show us what you have achieved, even just the half side. You have plenty of time.
Okay, alright. No?
You also love your glasses.
Okay. じゃあ、ちょっとリザルトの評価をします。Okay, I'll show you the result half side. You can see her subxiphomal hardness improved, slightly improved, the smooth contour, and see the apex pointed to chin apex pointed to chin, and you can see the mandible line, smooth line connecting to the chin apex, and slightly improvements the labiomental fold. Can you see, Dr. Stephen?
Can we have a look at the profile, please?
Okay. This is profile.
Much better. Thank you.
Yeah.
It's a lot better.
You can see mandible clear and pointed chin and forward cup. Anterior projection.
So how much product have you used so far?
So,
So in the chin projection.
1.4 milliliter per half side.
Okay, very good. Okay.
Yeah.
We will. Thank you very much. That's look excellent. We will come back
Okay.
when you finish the other side. Thank you so much.
Mm-hmm.